General treatment for shoulder pain, it varies wildly, right? I mean, like, it depends on what your problem is, right? So in general, you got an ache or a pain, you can always ice things down, take anti-inflammatories if you can take them. You can, unless you have an allergy or a contraindication, you can take up to 4 ibuprofen 3 times a day. That's maximum dose, right? Make sure you always run that by your doctor first, right? Because that's a prescription level. You can take up to 2 Tylenol as well, 3 times a day. Various other things you can try, right? You can do massage, you can do acupuncture, you can do lasers, whatever you want, right? Like, to try to if something's just bothering you. But if it's not getting better, you come in and see us. Often, for a lot of problems, well, it actually just depends. Like, there's some problems where I tell people, listen, it is unlikely that I'm going to be able to fix your shoulder unless I do an operation, right? If you look at the data, you look at our outcomes, you look at what we've seen, right? Now, I'm never 100% right, but there are some things where I'm like 97, 98% right. And so I tell people, listen, then there's a lot of things where I say, I don't know. Like, you have this, okay, this problem, and we're gonna try therapy, right? We're gonna try, a lot of patients, we try therapy for 6 weeks to 3 months, just strengthening the muscles of the shoulder and seeing if we can get the body to kind of reset itself by building up muscle, building up strength to fix the problem. There's some patients where I try a cortisone injection, and say, can we get this to calm down with a cortisone injection, and then do some therapy and see if it goes away. There's some problems where, like in an arthritic shoulder, can you do cortisone and just kind of, kick the can down the road with cortisone for a couple of months? Or yes, we will try that, right? We try anti-inflammatories for a lot of people. Occasionally we'll use things like PRP, which is where we spin down your blood and get a high concentration of platelets. There's a lot of different things that we do to try to treat now, and then there's the surgical realm, right? And so the surgical realm is meant for, patients that have a problem that's very unlikely to get better with physical therapy. And the unlikeliness of that depends upon the problem and also what they've done, right? If someone's been in physical therapy for 6 months and they have a tear in their rotator cuff and it hasn't gotten any better, it's unlikely to get better if they keep doing it, right? So it's important to kind of put all that information together. And then if we do the surgery, we've got a 97, 98% success rate. So a lot of and then the main surgeries we do are rotator cuff repairs, shoulder replacements, labral repair surgery. Those are the 4 main things we see, are the 3 main surgeries we do on people's shoulders. And then there's a litany of other operations we do that are less common, but that's the bulk of it, is those 3. So if and what we do, and it's always a conversation, and I never tell patients they have to have surgery. I don't pressure them into surgery. I just talk about what I've seen, what I think, what the probabilities are, what reasonable options are. And then I say, listen, it's up to you. I want people to be asking me to do surgery. I don't want to be trying to scare them into it or pressure them into it. And I very rarely, there's not that many things. There are a couple exceptions, but for the most part, I say, listen, think about it. Like, give it time. Like, and if you don't want to have surgery, don't have surgery. And for most of the problems we see, there's not a lot of consequences to waiting to see how it goes, right? The main consequence is, I've got this problem and it's really impacting my life and it sucks and I want it fixed. Like, that's the consequence of not getting it fixed. So, but is it going to get worse, right? Are you not going to be able to fix it in 3 months or 6 months? There's a couple of things where that's the case, but the majority of them, I tell people, like, listen, like, you want me to fix this today? Great. We'll get you on the schedule, try to get you done this week. If you want to wait 3 months, wait 3 months. If you want to wait 6 months, wait 6 months. A couple of things like big rotator cuff tears where it's retracted, it's a different conversation, but for most of them, it's really the patient's decision if and when they want to have an operation. And also what route they want to go. Some people, they come in, they've got a rotator cuff tear, it's very painful, and I say, listen, we can try an injection and therapy. And they say, Dr. Kruse, can we just fix this? Like, I just don't feel like that's going to fix my shoulder. Maybe I tried therapy before or for something else. And like, I don't want to mess around. I want to get this fixed. And the answer for us is yes, of course. Like, if you want us to do that, we'll just do that.